that button. There we go. Marvelous. So hopefully that's all visible. So this presentation is relating to a piece of work that's commenced as a result of the move from the road safety statement to future strategy thinking, but entirely independently. So it relates to an independent group that's been assembled with, as I say here, a purpose to deliver high-level advice to government and to seek support, further input across organisations as an alliance of consensus. Perhaps needless to say, but I will say there's been some discussion already this morning from David about the nature of today and it not being a tweet-tastic event. This is currently privileged information from us because we are publishing a report from this independent group at the start of next month, and that's being timed for sensible reasons. Again, to reiterate, we're doing this completely independent of government, but not disassociated to the extent that we're not talking to government. So the title that we've given ourselves is Safe Roads for All, which is indicative of the effort to be inclusive, considering all organisations, all road users, all government departments, all possible participants, and the absolute central importance of road safety to so many government strategies. The co-contributors of the August 2021 report are as listed here. So I would imagine that 99.9% of us in the room will recognise those names, and they will not need explanation. We're not setting ourselves out to be some crack Avengers team that's the best of the best, as it were. However, this did seem at the time and within the time that we had a sensible group together for reasons that I'm going to explain on the next slide. But once again, this is an inclusive endeavour, and we are up for all information and evidence building wherever we can receive it. So aspects of the initial collaborators, we have an absolute focus on safe system and Vision Zero as an ethical position, an inspiration, and an ultimate safety approach, as in safe, not safer. The expertise is clearly specialist from the list that you've seen, inclusive of all important road engineering expertise, vehicle engineering expertise. So really pleased to have the likes of Susie Charman and Richard Cuerden within our collaborators. But also more generic, holistic mobility expertise. Sorry if it's wrong to describe you as that, Dan Cancel and Nick Reed, for example, and also some collectively enormous numbers of years of experience with the likes of Jean Breen. I've now gone and left people out, which is going to offend, so that is what it is. Moving on, collectively it's provided us with a really, I think, useful range of reference and willingness to robustly cross-check views against evidence, and also I have to state to recognise that the expertise that we are coming to the table with is not comprehensive. Within our founding group, if you like, there have not been public transport primary expertise, road transport, carbon primary expertise, emergency care provision is another gap. So consequently, we do anticipate that there may be further editions of our report or supplementary papers may be issued, so to make that absolutely clear. So outputs and next steps. So on the left here, you can see the cover of the August report, Safe Roads for All, which we're describing as an expert report to UK government calling for a safe and healthy mobility strategy and action plan for roads 21 to 30 to deliver sustainability and prosperity. Those words have been chosen with care. There has been a joint letter from the co-contributors that has been written and is being forwarded as I speak to the Prime Minister, government and ministers across departments to make them aware prior to publication in August, which we believe ties in appropriately with government next steps and announcements. And from now, working to build an organisational Safe Roads for All alliance. In many ways, this can be perceived as similar to the cycling and walking alliance work that was so prize successful, to support the recommendations and identify any need for further refined recommendations, as I said on the previous slide. So for those organisations in the room, we will be coming to you, and we welcome you coming to us. We've established a vision that people and goods move on our roads and around our civic spaces in ways that are safe and healthy for people and the planet. So a positively framed vision. Definition of getting around may seem obvious, but it's not just about going from A to B, it's about moving around our civic spaces, the space between our buildings, that all important planning piece. This is about our roads and our places. And next, a definition of safe and healthy. So it's so vital, but it's not only about people not being killed or seriously hurt in crashes. It is about traffic pollution and people's lungs not being poisoned, people being able to get around in active ways as part of their daily lives, and traffic not contributing to the climate emergency. So this all beautifully chimes with the introduction that Ros has given us regarding the overwhelming important government strategic needs across all those areas. Some language that we use that I'm sure the room will welcome: crash, not accident; safe system and safe, not safer, unless we're using it in the context of moving to safe through a strategic action. Catastrophic injury, to refer to life-changing or life-threatening, to explain impact. And road victims, meaning bereaved and catastrophically injured and families, but wider, to include victims of respiratory disease. And of course, we're all victims of the climate crisis. And finally, a focus on work-related road risk management, and it's no surprise that that's already come up today with its importance. It's vitally critical to moving towards safe system that work-related road risk management is tackled. So we've taken a perspective that people principles, as is always the case within a safe system approach, need to be addressed, starting with the one that's always centrally explained within safe systems, that people make errors or humans make mistakes sometimes, and therefore designing the system to accommodate for that is important. But within these people principles, we've not just talked about error making and vulnerability. We've also talked about the positive aspects of being a human being, the human needs that we have to get around, but also what we respond to. We like a rich life, we like an easy option, we like cycle paths from our doorsteps and buses when we need them that are clean and reasonably priced and generally accessible. And we do care about things, and we do want change. We know from work that was DfT funded that we undertook on behavioural change that people really do want healthy, safe communities and want to speak up for change in their communities. So there's lots that can be celebrated about the human condition, as well as the problems of the human condition, which mean we need a safe system. So we've come up with a 9-point rationale for safe and healthy mobility, which then quickly and easily slots into some of the government priorities within their existing strategies. So they can be quickly read, but they're the obvious things from top to bottom, or bottom to top, should I say: prevention of deaths and injuries on roads, right the way up to net zero carbon, but seeing all the economic and socio-economic benefits within there, including infrastructure investment and good business innovation, skills development within the UK, and passing that out to the global stage, as again, as we've already heard from Ros, as well as the health benefits and the real immediate cost benefits that are so identifiable, such as saving our NHS, etc. here we go in terms of supporting government priorities to achieve that all-round prosperity. We've done a couple of circles. Thank you, Dan, for your work on the one on the left, safe and healthy mobility as an enabler. We have three balls, if you like, here, taking us from the need for personal, regional and national prosperity of all kinds, ranging from stimulated innovation through to healthy bodies, right the way through to the climate crisis being tackled. And that demands that mobility, safe and healthy mobility, is the right, that mobility is accessible, quality, efficient, inclusive and equitable, and that supports the government priorities that are already in place, ranging from the industrial strategy, Build Back Better, levelling up, net zero carbon, etc., to global Britain. And then on the right, thank you to Nick Reed for this, an indication about how the more in our face examples, so I won't say pilots because there's so much evidence around about safe systems already, but in our face examples in the UK of safe and healthy mobility measures actually being implemented and working, and the effects of that in the UK give us more reasons to invest in safe and healthy mobility solutions. So now we come to the crunch, which is what we are seeing as the need within government to set this up and lead. Again, to reflect that we're looking at a high level message to government here. We need governance, administration and advisory direction. So governance is the top line leadership, direction, target, standards, performance management, with all the understanding about the complexities of target setting and performance indicators and need for agreement on that. Administration, so in terms of departmental leadership, cross-department, delivery of investment and interventions with all relevant partners, and then advisory direction, so collision investigation, but also evaluation of that collision investigation and research and development significantly more widely. So how does that translate into leadership teams, as it were? We have proposed that the advisory piece is handled by a new agency, which we have named as a Road Collision Investigation and Safety Standards Agency, to encompass the many calls for many years for a road collision investigation agency, but also the very evident need for safety standards advice, for example, around highway safety standards, and to give that advisory direction absolutely independent of government, but to directly feed in to the direction that we believe should be led at governance level by a road safety board, providing that setting of standards, goals, targets, performance requirements and directing, and then the administrative leadership and coordination by the Department for Transport and all partners, national and local, statutory and non-statutory, and the wealth of skills across all those agencies at national and regional level. So moving towards a conclusion now, I'm just going to outline 3 goals that we've established and then 5 priority actions, and then finish. Number 1, we prevent harm from vehicles. Note that we have not used motorised vehicles there. We are inclusive of all vehicles, recognising of the impact of non-motorised vehicles as well as motorised, working towards eradicating deaths and catastrophic injuries in the long term and targeting incremental results towards this, and preventing deaths and illnesses from air pollution also, and tackling climate change. Number 2, we achieve the modal shift. It's so critical that people can move safely in active ways as part of their normal daily activity and have access to good public transport defined in the report within our towns and cities and between places. And thirdly, we care for the victims. And I think that this is really important as part of the building confidence point that Ros mentioned, that society is seeing that we are making a difference to achieve safe roads. And in the meantime, we are recognising the impact on people and caring for them, both in terms of our emergency service services, but also the humanity care they need for their health and wider well-being. I would stress that as the charity that's running the National Road Victim Service in the UK, which is in desperate need of funding. Work areas, we identified 4 work areas before I quickly move on to the priority actions. Safe space for all people to walk and cycle and good public transport. Safe road infrastructure, speeds and safe, clean and green vehicles. Tying those elements together as of course CAV does. Safe standards for drivers and for organisations managing vehicles for work. So in there we can think about the compliance and also that positive human aspect of people wanting change. And then fourthly, excellence in collision investigation and in road victim care. So the 5 priority actions, just to quickly whiz through this, Dave, because I don't want to put us behind today. Number 1, goals, targets and performance indicators, adopting that long-term goal for a road network that is free from death and catastrophic injury, adopting that global 50 by 30 road casualty reduction target, supported by safe system performance indicators and targets in line with international best practice that can demonstrate if we are moving people and goods on roads in ways that are safe and healthy. Secondly, a functional hierarchy for roads and road investment. This is so important that we get busy establishing that hierarchy that enables safe and healthy mobility equally, that enables active travel where people would want to travel actively, that they may not be doing so at the moment because of fear. And ensuring that the budgets are directed to achieve roads identified functions by identifying and proactively treating priority road sections to get the desired effect, and prioritising safe space for walking and cycling, and mentioning within her 20-mile-per-hour limits that are so important, and advisedly saying where people live in the broadest possible meaning of live, as in where people move around. Vehicle safety standards, essential that we incorporate into UK law more minimum vehicle safety standards inclusive of the substantial life-saving vehicle safety laws recently adopted in the European Union through GSR and the pedestrian safety regulations, and also acknowledging the importance of standards as well, such as the standards that Transport for London has been setting for large goods vehicles and buses. Fourthly, the whole compliance piece and public involvement piece, looking at improved roads policing and a reviewed legal framework as a priority. We will all recall the recommendations of the Inspection of Roads Policing report. There's also a need clearly to undertake a review of many aspects of the legal framework and for opportunities to improve road user safety within that. So a few of the most commonly raised issues are listed here, as you can see, inclusive of phased driver licensing, graduated driver licensing, lower drink drive limit, power to stop and test, and certainly provisions to manage work-related road risk, as well as a review of traffic laws and sentencing guidelines more generally. And finally, that best practice help for road victims, including a nationally commissioned standards-driven National Road Victim Service that is immediately accessible and levelled up to victims through the police across the whole of the UK. Just to give a little bit of an indication of what I'm talking about there, we have in total 6 caseworkers for the whole of the UK, and we need between 50 and 100 depending how you calculate and what level of service you provide. Massively under-resourced service at the moment. And the investment opportunity to benefit cost value is enormous, and there's so much more work that could be done on this, but even within road treatments we can see the huge savings that range from 3.7 to times 13, and these are DfT calculations and Road Safety Foundation calculations. Thank you to Susie for updating that last week. And that is the end of my presentation, and all organisations can support the Safe Roads for All Alliance, and I'm really pleased to be here, David, supporting this broader stakeholder event. Thank you.